Hi guys. Okay, I've come today to talk about autoimmune diseases. Your immune system's job is to defend and protect against disease. When you have an autoimmune disease, the immune system's malfunctioned and it's turned against your healthy tissues, attacking your healthy tissues as if it was disease, i.e. the thyroid, the synovial fluid, etc. That's what it's attacking. The immune system's attacking those things instead of attacking the bad things. There are roughly 80 known autoimmune diseases and many share symptoms, so it can be quite difficult to get a diagnosis or determine which disease you have. And many of the symptoms can overlap from one disease to another. Many people have more than one autoimmune disease. It depends which disease you have, obviously, but there are several autoimmune diseases such as RA, lupus, celiac, pernicious anemia, scleroderma, psoriasis, psoriatic arthritis, inflammatory bowel disease, Hashimoto's hypothyroidism, Graves, Addison's, Sjogren's, type 1 diabetes. Autoimmune diseases tend to come in groups. Many patients have more than one, and I have 8 different diagnoses of different autoimmune diseases, and several more have been mentioned along the way but not pursued. I've got the rheumatoid arthritis, the Hashimoto's, the Sjogren's, I've got loads. About 3/4 of patients are female, suggesting that hormones play some sort of role. Autoimmune diseases tend to run in families. Mine run in both sides of my families. RA. The causes are still not certain. There are many schools of thought. Some believe the answer lies in the gut, which is certainly likely for those affected in the stomach, with ulcerative colitis and so on. That's likely to be stemming in the gut. I haven't found any allergies. I've tried all of the elimination diets and everything back when I first got very poorly. And I haven't found any allergies or any benefit from changing my diet. I have changed my diet and I live as healthily as I possibly can. Literally hundreds of miracle cures get pushed on you all over the internet when you say that you've got an autoimmune disease. If it really were as simple, none of us would have these diseases. We suffer so much that honestly we would and have. Certainly in my case, I've tried every homeopathic, naturopathic path possible. Don't get me wrong, many things have benefits. I use aromatherapy and so on. I will do some video covering the things I've discovered beneficial enough to continue. Such as Epsom salts in my baths and stuff like that. I'll cover a lot in videos to come. I make all my own products to benefit my disease and symptoms because I believe in reducing toxins and chemicals in our environment, but thus far nothing, not even any of the RA drugs, have cured me, which is probably because autoimmune diseases are incurable. Even when I tell people I am dying because of my disease, they still recommend an exercise regime and changing diet. Of course they see my body and assume my obesity has caused my ill health, when in fact the opposite is true. I changed from 8.5 stone to 16.5 stone in 4 months, and most were caused by swelling over my whole body and the high dose steroids trying to control it. Steroids, prednisolone, is used in pretty much all autoimmune diseases. In fact, many of the drugs are used across many of them. We share the drugs. They are used sometimes in different dosages and different combinations, but yeah, they are, most of the RA drugs are used in other autoimmune diseases as well. It is believed that many factors combine to trigger an autoimmune malfunction, i.e. RA runs in both sides of my family, as does Hashimoto's. I smoked most of my life up till I was 2014. I had several years of constant viruses, infections and a botched gallbladder surgery and months on antibiotics and steroids. Symptoms shared by many are fatigue, fevers, feeling ill, a general feeling of just not well. In fact, you're absolutely exhausted most of the time. Symptoms will ebb and flow with flares and remissions. Remissions, if you're lucky. I have never had any remission from my symptoms since this all began. Not like a full remission. I've had a slight lack of swelling, which would rapidly recover quite quickly, but some people do get it where it comes and goes and comes and goes. I just got hit by a freight train. Common organs affected are, or organs and body tissues, joints, muscles, skin, red blood cells, blood vessels, connective tissue and endocrine glands. Blood tests can help in diagnosis but are not definitive. It's possible to have the disease without having it showing at a blood test, and it's also possible to have the positive blood test but no clinical symptoms of the disease, and thus you won't be diagnosed with the disease until it starts showing its ugly head. So the blood tests aren't definitive, but most of them would seek out for auto-antibodies, such as for RA, you've got the rheumatoid factor and the anti-CCP, anti-citrulline-related, I can't remember how it goes, but it's anti-CCP. That's what I'm positive for. For Hashimoto's, they check for thyroid antibodies, so on and so forth. There's lots of different blood tests, but most of them are not definitive. They don't depict every case. Then they'll also run blood tests like standard blood tests, your full blood count, because if you've got autoimmune diseases, it'll show up that you're not quite right. My blood tests have never been right, like properly right. They'll do CRP, which will only be present if your body is fighting inflammation. Most people don't have CRP in their blood unless they are fighting off something quite nasty. ESR will show up inflammation too, and what like level of inflammation you've got in your body. Treatments vary depending on the disease, and autoimmune diseases can vary greatly from one case to the next, and it can be highly complicated by comorbidities. And then I know a lot of people who have the same diseases as me and they're living a perfectly normal life as if they haven't even got anything wrong with them, and I'm sure they would say it's because they're more positive than me and they're better than me in some way, but in actual fact it's probably because the drugs just worked for them and the drugs didn't work for me, unfortunately. And I've got the complication with my lungs, which prevents me getting a lot of the help that I could get if I didn't have those complications, you know what I mean? Does that make sense? See, the medications can cause a lot of their own issues, so it can be very dangerous. Like, I'm not allowed to take almost every RA drug there is, because they will damage my lungs more, so I can't take them. So I now live in the constant full-on flare of RA. I mean, my body swells. I've got swelling in places that aren't even supposed to be able to swell. If you're anything like me and have multiple conditions, it can be very difficult to find the right treatments. I often find my multiple consultants will all have different ideas about what they're going to do with me. So, anyway, that's a rough guideline to what autoimmune diseases are, how it happens to us, the way they work, the way they are treated, the way they are diagnosed. If you have autoimmune diseases or just one autoimmune disease, I hope you'll join me here on my channel where I put out lots more videos. Check out my Pinterest board, Autoimmune Me. Please do. I hope you'll join me here, subscribe and click on that notification bell to get more videos coming. Much love to you all, guys. Breathe easy.